Hello everybody, this is Lisa Elia here in the Professional Presence and Influence video number 2 discussing social and emotional intelligence. I am starting today with self-awareness, and for my 2 skills I used were mindfulness and compassion. My example are hostile patients. We all have seen them. We need to deep breathe. Well, some of us. We need to actively listen. We need to be mindful to control our emotions, anger, frustration. We have to be compassionate, to empathize with our patients' fears, their frustrations, in a non-judgmental manner. We have to calm these patients' fears so that we can treat these patients in a professional manner so that they can feel comfortable in our presence. Moving on to executive function, and for this I chose critical thinking and problem solving. And my example was a charge nurse. Charge nurse on a daily basis has her newer nurses come to her for help with all kinds of issues, whether it be an assessment problem with her patient, how to deal with a patient issue. But the charge nurse must then use her critical thinking and her problem solving skills to quickly assess the situation, come up with a solution, and oftentimes it is required of her or him in a very, very quick amount of time. And we nurses must do this on a daily and a minute-by-minute basis. We must prioritize the care of all of our patients based on acuity. We must plan and we must organize our patient care. We must educate ourselves. We must do this oftentimes in a self-directed manner, using executive function. It is critical to a professional nurse. Moving on to self-management, I used resilience and self-discipline. My example is one applying for a promotion at work and is passed over for another coworker. One can handle it in one of 2 ways. They can be either resilient, they can be determined to learn the skill sets needed to be competent in the role that they applied for. They can see it positively and have the self-discipline to learn the necessary skills that they are lacking and become competent in the skills and reapply for that position or a similar position. Or they can become resentful, blame others for the lack of acquiring the position, and become negative. As a professional nurse, we must maintain the first and remain resilient, learn the tasks that we are missing, the skill sets we are missing, all of the components that the job is required upon us, and follow through and be positive so that we can apply again for the position. Finally, we're moving on to interpersonal communication, and I use compassion and active listening. My example, it's a little bit morose, but in the cath lab, we have a bit of a higher mortality rate than other departments in the hospital. And the loss of a loved one, communication becomes immediately, it becomes intimate. The nurse must respond compassionately, empathetically, supportively, a shoulder to cry on. Again, I must emphasize empathetically, she or he has to go home at the end of the day and say, I have done all I can for this family. And it's difficult, and it requires, again, a lot of empathy and compassion. I hope you have enjoyed my video, and I thank you for watching. Bye-bye.